We're here today because we're battling one of the worst drug epidemics in U.S. history. Howard County, like other communities across the country, is experiencing the tragic impact of this crisis every single day. In 2017, to date, the Howard County Police report 216 overdoses, and tragically 55 of these have been fatal. And each year we have seen these numbers increase. We've ramped up our response to the crisis, hiring a full-time heroin coordinator at the police department, adding an opioid project administrator at the health department, and increasing the availability of crisis intervention services at the Grassroots Crisis Center. We've also created public service announcements that are running in local movie theaters and are working on a centralized website to provide information about prevention, treatment, and recovery from all agencies across the state. We're working on hiring a behavioral health court liaison to improve access to community resources for individuals involved in the criminal justice system. And as many of you know, we are looking to secure a site to build a detox and rehabilitation residential center within the county. Members of our police and fire departments are trained in the use of naloxone and have it available when they respond to calls. Our schools now have naloxone on site, and our health department has trained more than 2,000 individuals across our county, from staffs at motels and hotels and treatment centers to concerned family members and friends. Today, we are announcing another step in this fight. We will be adding Narcan to our AED boxes in all county-owned buildings throughout Howard County. We will now have Narcan available in county buildings just as we have AEDs and Stop the Bleed kits. We are able to take this step because of the generosity of the Aetna Foundation, which has supplied the county with 408 Narcan kits containing 816 doses of this life-saving drug. Our partnership with Aetna is the first of its kind in the state of Maryland and demonstrates Aetna's commitment to battling this health crisis. These boxes you see piled right here, they represent our ability to save lives. In Howard County, as I've said, we've tragically lost 55 people so far this year. We also need to remember that 161 people have overdosed in our county but have survived. The vast majority, in fact 90%, because of naloxone. I'm committed to having as many of our 3,000 county employees trained in its use as soon as possible. So today we are announcing, and I appreciate the county administrator being here, Lonnie Robbins, working with me on this. Today we are announcing that any county employee who wants to be trained in the use of this life-saving drug will be allowed an hour of administrative leave to do so. Immediately following this press conference, we will train the first group of county employees in the use of the Narcan kits to be placed in the AED boxes right here in the conference room just off the lobby. In the months to come, our health department will work with all departments in the county to bring this training to the rest of our employees. I definitely want to thank our colleagues from Aetna for being here today and for making this happen. I want to thank our dedicated health department officials and staff for continuing to work tirelessly in this fight, and also all of our employees who have volunteered to get trained. And now I'd like to turn over the podium to our health officer, Dr. Maura Rossman, who has been integral in our efforts to fight this epidemic. Dr. Rossman.
Thank you for joining us today to announce Howard County's unique partnership with Aetna to combat the opioid crisis. This is an important effort to reverse the trend of opioid overdose deaths that are increasing in Howard County, similar to trends seen in other counties and the United States. We are appreciative of County Executive Kittleman's support, county agencies' participation, and Howard County Fire and Rescue's advice and guidance, and of course, to Aetna. This project is truly the result of collaboration and would not be possible without our partners. Heroin-related overdose deaths in our county have more than quadrupled since 2010. Our strategy to combat this issue includes prevention, treatment, recovery, and enforcement. Efforts are underway to increase awareness of this awful disorder and to reduce stigma. We support enforcement activities to curtail the influx of illegal drugs like heroin and fentanyl, and are expanding timely and effective treatment options and preventing overdose deaths by training the community in overdose recognition and naloxone administration. Naloxone is a life-saving medication that can reverse the effects of an opioid overdose when administered in time. Opioid addiction knows no geographic, socioeconomic, age, or race boundaries. Overdoses occur anywhere and everywhere in Howard County, including parking lots, homes, stores, restaurants, restrooms, and public places like we are in today. The Howard County Overdose Response Program includes education about recognizing an overdose, training to administer naloxone, and distribution of naloxone kits to individuals who have been trained. The current reach of our naloxone program is limited to individuals. There is a need for this important medication to be available in a variety of public settings at all times, similar to the presence of AEDs. Stocking naloxone alongside the AEDs in county buildings makes naloxone available to all trained community members, not just a single individual. The Health Department will facilitate the training of county employees to recognize and respond to an overdose, including administration of naloxone. We are partnering with Fire and Rescue to develop policies and procedures to ensure quality program and system effectiveness. I'm optimistic through coordinated efforts and partnerships, we will turn this crisis around. Because of Aetna's generous donation, we will be able to ensure that members of the community, visitors, and employees who enter our county buildings are able to access needed medication to save a life so that no other family experiences the pain of losing a loved one to addiction, and those with substance use disorders are able to achieve health through recovery. Thank you so much for being here, and thank you, a shout out to the Health Department staff who every day make amazing things happen.
And so this morning about 10 o'clock, Deputy Manning was in court providing courtroom security, as he does and our deputies do every single day, when across the radio came a call for a subject who had collapsed outside. So he and a number of other deputies responded out there. They took advantage of that training. They recognized the health emergency that was going on. They recognized that opioid abuse was at work. And part of his team went to our AED cabinet, grabbed the Narcan, got it back to Deputy Manning, who was able to administer the drug, able to keep that person alive until the fire department got there, who gave additional treatment, and then got the person to the Howard County General Hospital. And I am told, as a couple minutes ago, he's conscious and talking to his caregivers. So it's really a success story for him. But I think it's also a testament to the collaborative effort that public safety and county government and private partners across the county are working together to deal with this. So, we appreciate the support we got when we started down this path to equip and train our folks. And I think this morning, Deputy Manning's actions and the actions of those other deputies prove the value of that partnership. So, thank you for the opportunity to tell our story. Good job, Dave.
This summer, some of my colleagues learned about some of the steps that Howard County was taking to address the crisis, and after an initial conversation with Dr. Rossman, we learned we had an opportunity to help Howard County directly address the challenges of opioid overdose. And as a resident of Howard County for over 25 years, I'm honored to respond to this important call to action in my local community with this donation of these Narcan kits. As we've heard today, they can and they do save lives.
We commend Howard County for combating this problem with a data-driven initiative that support prevention and recovery. This has included training all county police officers to administer naloxone. You've already heard one success story today, as well as the Health Department's free opioid overdose response training sessions. These programs and resources are at the forefront of the opioid abuse intervention movement, and Aetna is proud to call Howard County our partner in this fight. To support state and local efforts, today the Aetna Foundation is honored to donate 816 doses of Narcan to Howard County. Providing Narcan to the front lines of this epidemic can and does save lives, and as importantly, it grants those affected by the opioid epidemic the opportunity to receive long-term treatment and support they direly need. Aetna's partnership with Howard County dates back nearly 10 years, and today we serve nearly 8,000 local residents. As an enterprise, we've set forward 3 ambitious goals for the next 5 years. We seek to first increase access and treatment of chronic pain with a multimodal approach by 50%. That means instead of just getting a prescription for opioids, members would get treatments such as physical therapy, acupuncture, or other evidence-based pain modalities. Second, we hope to increase the usage of medication-assisted therapy, such as buprenorphine, for our members, for those members affected by opioid use disorder by 50%. And finally, we hope to reduce inappropriate opioid prescribing to our members by half. Beginning January 1st, Aetna will implement a 7-day quantity limit on opioids prescribed for acute pain and post-surgery. This initiative, targeting first-time prescriptions, aims to reduce excessive overprescribing and, most critically, reduce diversion and the potential for dependence. We are also very proud to announce that Aetna will waive the copay for Narcan for all fully insured commercial members. By removing this financial barrier, we are working to increase access to this life-saving intervention. We often talk about this as a national crisis, but the impact is felt locally in the states and individual communities like Howard County. Howard County is setting a vital example for the entire state of Maryland, and I urge all local government and members of the state legislature to work together to identify new opportunities to battle the opioid epidemic together. I strongly believe by joining forces and learning from each other, we can successfully combat this devastating opioid epidemic so that all members of our community can live the healthiest and fullest lives possible. Thank you so much, and I look forward to a continued collaboration.
Thank you very much, Thank you very much, and thank you also for taking those other efforts. We talk about prescriptions. I remember when my oldest daughter had her wisdom teeth out, she got 30 pills of oxycodone. Now, this is a little bit ago, but I mean 30. She didn't use one. And then my other son just had his wisdom teeth out just a few weeks ago, and the word from my wife and I were no addictive drugs. And he didn't get anything, and he was fine. He had Tylenol. Luckily, he was okay. But, you know, it happens, and we need to make sure. But I thank you for your leadership in helping us to make sure that doesn't continue to happen. What I'd like to do now is to take one of these packages and put it actually for the first one in the AED right here. And Dr. Rossman, if you could join us and as we do this.